Hello guys, we are going to talk about another topic on antibiotics. We have discussed sulfonamides, beta-lactams, that's the penicillin, cephalosporin. Now we are going to talk about aminoglycosides. Aminoglycosides. Another interesting topic is aminoglycoside. Aminoglycosides are not absorbed in the gastrointestinal system and are given by injection. Majority of them are given by injection for systemic infection. Excretion is mainly by the kidney and the accumulation result to renal impairment. Prolonged taking of aminoglycoside usually lead to renal impairment. Example of aminoglycosides. They include gentamicin, streptomycin, neomycin, spectinomycin, thromycin, nectilmycin, spiramycin. Note, the excretion of aminoglycoside takes place mostly through the urinary system, and it usually leads to renal impairment with prolonged use. What is the mode of action of aminoglycosides? The mode of action of aminoglycoside. The drug inhibits protein synthesis of the microorganism. It inhibits protein synthesis of the microorganism by binding directly to the 30S ribosomes, resulting to bacteriostatic or bactericidal effect. The 30S ribosome is the genetic material of the bacteria. Is a genetic material of the bacteria, which is usually in a spiral shape. The spiral number are many. The spiral number of the bacteria are many. Some bacteria have the spiral genetic material up to 60 or above. And the drug bind at the 30S ribosome of the genetic material, which inhibit at that 30S ribosome, the protein synthesis is inhibited. This bacteria or the organism that is killed by the aminoglycosides depend on protein. When this is inhibited, it leads to bactericidal or bacteriostatic. Indication. What condition do you give the aminoglycosides? Septicemia, that's infection in blood. Bacterial infection in blood. Abscesses. Abscess on any part of the body. Endobacteria. Adjunct with other antibiotics. That is, this drug can be given as an adjunct. It is given together with other antibiotics. It can be given together with drug in the penicillin class like ampiclos or amoxicillin in the treatment of gastroenteritis, septicemia, depending on the level of infection. Synergistic approach to the treatment of the bacteria is very important. Renal infection, you can give this drug in the treatment of renal infection, chest infection, tuberculosis, pelvic inflammatory disease, endocarditis, brucellosis, plague, surgical prophylaxis. It is given in the prevention of infection either during surgery, before surgery, or after surgery. Contraindication: myasthenia gravis, renal impairment, neonates, pregnancy, breastfeeding. You don't give it to breastfeeding mothers. Hypersensitivity to aminoglycoside. Any patient that reacts to aminoglycoside, that is neomycin, any patient that reacts to streptomycin, you don't give this drug to them, and other aminoglycoside. Side effects: vestibular and auditory damage. It damages the vestibule and auditory, that's the ear. Nephrotoxicity: to prolonged use result to renal toxicity. Rarely hypomanganesemia on prolonged use. Antibiotic-related colitis. There is inflammation of the colon related to antibiotic. Stomatitis, rash, blood disorders. Aminoglycoside dosage. Gentamicin injection, 10 milligram per ml. It comes in 10 milligram per ml, 40 milligram per ml in 2 ml vials. Gentamicin injection, 80 milligram. It can be given TDS for adult. 80 milligram TDS for adult, which usually come in 2 ml. That is, an average of 250 milligram is given. Neomycin tablet per oral, 500 milligram oral liquid, 500 milligram, that's a tablet, 500 milligram. Oral liquid on neomycin, we have 100 milligram per 5 ml. Every 5 ml contain 100 milligram. 10 ml contain 200 milligram. The streptomycin comes in 1 gram, that's injection, 5 gram in vial. Then we have streptomycin, dose. It is given, the streptomycin is given by deep IM injection. Adult, 15 milligram per kg. It is given 15 milligram per kg. Maximum of 1 gram daily. Spiramycin tablet, 3 milligram international unit. 3 million international unit. Spiromycin tablet, 3 million international unit. Nursing implication. Obtains body weight for correct calculation of dosage. You must check the body weight. If it is given like streptomycin, which is given per kg weight, 15 milligram is given per kg weight. If the patient is weighing 10 kg, you now multiply 10 kg per times 15 milligram. Administer intramuscular injection in large muscle area. Observe intravenous infusion site for inflammation. Note that IV injection is contraindicated in streptomycin. Don't give streptomycin through IV. Obtain specimen for culture and sensitivity tests. Then you continue the therapy as you wait for the drug result. Provide supervised ambulation. Other safety measures for patients with nausea, vomiting, dizziness, headache after drug administration. You increase fluid intake to minimize irritation of the renal tubules, especially in gentamicin administration. You monitor renal function such as output, specific gravity, urinalysis, bone, that is the urea and creatinine, urea, creatinine, and nitrogen level. Report any sign of decreased renal function. Observe patient for superinfection, that is prolonged fever and other signs of infection, especially on the respiratory tract. Thank you for listening. Always remember to like, subscribe, and comment. Bye.